Hi, everyone. I'm Connor Loy, the CEO and co-founder of Romix Biosciences. And I'm very excited today to talk about our liquid biopsy platform to better understand inflammation. So to start, I want to talk a bit about AI and machine learning. So AI and machine learning has promised to do many, many things, right? One of which is to better understand disease and better understand biology. However, the data needed for AI and machine learning, the data needed to better understand disease, has very specific requirements. It needs to be from patients, human-derived. It has to be scalable, and it needs to reflect disease and biological function. Current tools from patients, current measurement techniques, make you choose. So tissue biopsies are fantastic for understanding biological function and understanding disease, but it's impractical to scale to tens to hundreds of thousands of patients. Cell-free DNA processing from plasma is very easy to scale. It's a blood test. It's being scaled currently, but it doesn't really provide much biological function, insights into disease. PBMC, or circulating immune cell profiling, is a little bit more function, but really just focused on circulating immune cells. And the disease isn't just happening in circulating immune cells, it can happen anywhere in the body. And then proteomic platforms are in between, with technology development still needed to really understand and interpret these findings, mostly because they're targeted and using imperfect systems. So we don't have really the data to get the huge unlock from the algorithms to understand these things. My PhD at Cornell, we discovered that cell-free RNA hits all of those points. It's scalable and it provides function. So to back up, cell-free RNA are cells throughout the body. You can think of them as bags of RNA. And that RNA composition and the RNA in those cells reflect the activity and function of the cell. It tells you what the cell's doing. Now, during disease, cells release their RNA into the bloodstream. That RNA then becomes cell-free RNA, and we can pick it up from a simple blood draw. That RNA comes from all over the body. So when we look at cell-free RNA, we're looking at RNA that came from the bone marrow, from the nervous system, from the heart, from the lungs, from the liver, from really all over. And because of this, it's telling you the function of those disease cells. We can measure it from blood, so it's scalable as well. And of course, it's patient-derived. It's coming from blood. And we're putting together the best team to create the cell-free RNA platform. I've been studying cell-free RNA and inflammatory diseases in various settings for over 6 years now. I did my PhD and a postdoc at Cornell on this. My co-founder, David McKellar, is an RNA technology expert. He's helping to build better engineering tools to measure cell-free RNA. And our co-founder and PhD advisor, Ewan DeVlamic, is a professor at Cornell, serial inventor and experienced entrepreneur. And we're putting together an advisory team of individuals with experience in liquid biopsy, in diagnostics and therapeutics, as well as in the clinical and medical side. So I want to talk a bit about the platform we're building. Cell-free RNA is difficult to measure. It's very fragmented. It's in the blood. It's not an easy thing to grab, analyze, and interpret. So we're building an end-to-end platform to interpret cell-free RNA. We're building better tools to analyze it and prepare it for sequencing. Once it is sequenced, we have a custom AI machine learning framework where we integrate single-cell data sets, as well as over 3,500 patient data points we already have processed. Now, what does that actually mean? When we have a single patient sample, we can get deep interpretation from it. We can interpret it. We can tell you organ health. So I can take a single blood sample, analyze it, and give neuronal inflammatory scores, vascular inflammatory scores, what kind of biology is happening in the liver. We can provide mechanism of actions to drugs that are really hard to understand what they're doing. And we can provide therapeutic targets to diseases that are hard to biopsy, such as cardiovascular disease. And using this platform during my PhD studies, we applied this in many different settings. We published 11 peer-reviewed publications, and as I mentioned, processed over 3,500 patient clinical samples. We discovered cell-free RNA reflects the tumor microenvironment, the tissue around the cancer that's very hard to analyze currently. It reflects lymphatic and hematopoietic activity, which are hard to biopsy. It also reflects disease in the lungs, the kidneys, and in the heart, all from a single blood sample using the same platform. And this is the business model we're moving forward with to build out our cell-free RNA platform. This is through building through partnerships and moving to clinical testing, where pharma provides samples as well as clinical metadata and funding. And we use our platform to analyze those samples, provide insights on patient stratification. But what's really important for us is we're also providing mechanism of action and drug target insights. We're providing biology, something that a lot of early stage diagnostic or precision medicine companies can't do for the reasons I described on our first slide. This can move to clinical testing. We're providing patient stratification for clinical trials or direct to clinic, as well as pharmacodynamics. And what's really key here is we're building out this really interesting data asset. I strongly believe cell-free RNA is one of the most interesting data sources for disease biology. And this business model isn't something we made up. There's lots of very successful companies doing something similar, not with cell-free RNA, but with other methods. Tempest AI is doing something similar, as is Guardant Health, Foundation Medicine, building really interesting data assets from human-derived samples. So I mentioned a lot of different applications. We've really found the three most interesting ones, both for what cell-free RNA can do and where all the key stakeholders in healthcare are being brought to the table. This is an immunotherapy response and predicting CAR T cell therapy before treatment. This is in monitoring cardiovascular inflammation, starting with Kawasaki disease, as well as characterizing kidney disease. So I just want to clarify, this is not just an idea we have. This isn't just a concept. We have publications, data, and collaborators and IP that we're licensing from Cornell on all of these applications. And this is what we're moving forward with. We recently launched, but we're already scoping projects with some of the largest pharma partners in these spaces. And I've mentioned the market sizes here are for clinical testing, which I think clinical testing alone could make Romix a very good company. But what makes Romix a fantastic opportunity is the data asset. The biomarker space is growing rapidly right now. And I'm showing a very large total addressable market. But what I think is almost more exciting is the compound annual growth rate of 25.9%. So it's a really rapidly growing space, driven by AI machine learning and drug target discovery, which is what the Romix platform is creating the correct data for. This can be used for data licensing to pharma partners, such as, like I mentioned, Tempest AI does, as well as development partnerships where we can go all the way from target discovery through clinical trials with a partner. So we just launched in August. I did the Cornell Ignite Fellows program, which was a fantastic opportunity to discover our business model, find the most interesting markets that bring everyone to the table. We've raised 1.1 million from fantastic venture partners, Arc Capital Management, 2048 Ventures, First Star Ventures, and we're looking to raise 1.3 to close out our pre-seed. And this funding will allow us to develop our better tools and finalize that IP for molecular measurement, automate our pipeline so it industrialized so we can start processing many samples, and then finalize contracts with pharma partners, which we're already starting to have some great traction with. So thank you very much. Appreciate it.
I guess one initial question. In those discussions with your pharma partners, have you gotten a sense of whether they are comfortable sharing data in a way that will enable the data licensing model that you have planned? Often data providers can be quite protective of the data they have if it's not going to be limited to their use.
Yeah, really great question. And that's something we're working through currently with some of these partners. But what we found is if it's de-identified and we're not selling that data set, but we're selling an abstraction, like we train a model on that data set and then we can train the use of that or license the use of that model, that's something they're comfortable with. There's also like certain regulatory considerations here. We can't take data from one person and just license it to another. So we would have a license or ownership of that data, but we wouldn't be able to sell that data file. We'd have an abstraction, which is really what's useful anyways.
How are you pricing when you're dealing with the pharma partners?
So currently we're pricing through partnerships with shared paying. So we're essentially having them pay for cost of goods at the moment just to get these initial pilots going. And then once we are structuring more larger partnerships, this will be probably about $1,000 a sample for processing. Our cost of goods to go from plasma to data currently is $145, and that's going to be coming down to around $50 once we're at scale.
So it's a cost per service, there's no downstream economics to it.
There will also be that, but that's the base is the cost per sample processing, and then it's going to be very bespoke when it comes down to clinical testing, use in clinical trials, who has access to these sorts of assays. Yeah.
And how would you scale that, like that aspect of what you just described? Like how it becomes then very bespoke. How would you scale a business based on a bespoke model?
Sure. So the bespoke aspect is for these individual partnerships. The individual partnerships are creating the data that can be used as a clinical assay. And that clinical assay is then scalable for use in the clinic. So we can use the assay, for example, for the CAR T cell therapy. I guess I don't have exact data on that. But the CAR T cell therapy, we can predict response to CAR T cell therapy, use that in a clinical trial setting. That data can then just be used in the clinic for selecting patients for therapy. So the partnerships angle is only part of what we're doing. It's also worth noting these partnerships are very large dollar partnerships, the types of development partnerships that we're working with here. So that's how we're thinking about it.
All right, I'm hesitant to ask this, but I'm going to do it anyway.
Okay.
So as I'm hearing your presentation, it's hard for me not to draw parallels to another company that promised quite a lot from blood tests.
Yep.
And can you just put my, at ease to know why you guys are different?
Absolutely. We've published 11 papers on this that have been peer reviewed. I actually completed my PhD and undergrad. We're an engineering team, and we're not just using microfluidics, hand wavy. This is real science. This is real engineering. This is real biology.
Good answer. Thanks.